let's talk a little bit about eating well to help with your surgical recovery. Nutrition is so important after surgery, and making sure that you're eating well in those first few days post-operatively can help make sure that you're getting in what your body needs to heal and recover. Those who eat well after surgery have fewer infections and fewer readmissions to the hospital. There are some things that you can do to help prepare for surgery. The first one is planning ahead. This may mean going food shopping before your surgery so that you have foods on hand that you enjoy when you're not feeling well, whether it's a particular brand of cracker or a specific beverage that you like. Another thing that you can do is reach out to your care team and ask for a referral to one of the dietitians. The James outpatient clinics all have free access to a dietitian who specializes in oncology nutrition. This can especially be needed if you have other underlying medical conditions, such as gastrointestinal problems or diabetes. Thirdly, I would encourage you to talk to your care team about any dietary supplements that you may be taking. And last but not least, do not try and intentionally lose weight leading up to your surgery unless you have been specifically told to by your surgeon. As much as I wish I could tell you that you will not experience any type of side effect after surgery that will impact your ability to eat, that's not always the case. Some people will have some nausea and vomiting, especially immediately after anesthesia. Pain can sometimes also be a barrier to eating well, as can fatigue. Changes in bowel function and changes in taste and smell are very common. And some people may also experience gas and bloating. There are some quick and easy strategies to help manage some of these side effects. The most important is to focus on eating small, frequent meals throughout the day. If you're someone who's used to eating a big breakfast, big lunch, big dinner, that might not work in those first few days after surgery. So maybe instead of having a whole omelet with some toast, you end up having just a slice of toast and an egg. Instead of eating that full sandwich for lunch, maybe it's a half a sandwich or even just some crackers and cheese. Even more important than the food intake in those first few days after surgery is the fluids. Please make sure that you are drinking enough fluid. Most people need a minimum of at least 2 liters or about 8 8-ounce cups per day of hydrating clear fluids such as waters, decaffeinated coffee, decaffeinated tea, and even clear sodas. So while small frequent meals is a universal recommendation to help ensure you're getting enough nutrition after surgery, some people do need some additional suggestions. I would encourage you to check out the Eating Hints booklet through the National Cancer Institute. This is a fantastic resource and provides some food lists, specific recommendations to manage different side effects, and it even includes some recipes. So in summary, it's very important that you make sure that you're eating and drinking enough to help yourself recover. You want to make sure that you're staying in touch with your care team if there's any inability to consume enough food or fluid. And then you also want to just be kind to yourself.